we have a very interesting session on information and communication technology in healthcare. So when we talk about ICT or IT in health, how many of us would like to believe that there is something happening in IT in the government? Would like to believe that there is something of IT happening in the government, in the health. Okay, a few hands up, but none from the private sector seems to be putting their hands up. You don't believe we do some IT in health? Oh yes. Okay. So for your kind information, I'll just let you know some. I'd like to tell you what you've done in health. See the IT, what you've done in IT. See, every time you have a new mission director, a new secretary, or a new director, we are good at coming out with a software.
New software.
A very new software with every passing secretary, mission director, commissioner, so on and so forth. So at this point of time, you will all be happy to know that we have more than 40 softwares working in the health department. And many of the people are clueless in their own section that there is a software running. So this is what we are grappling with. So what we have tried to do as a start is link up all of this software and try and make some sense out of it, try to analyze the data and take some effective decisions. So we have some well-known softwares like the MCTS, Mother and Child Tracking System, the HMIS, which is widely used for various data analysis, the IDSP data is widely used. So what is happening right now is there are various data fields integrated with various softwares, but there's no coordination between various entities. So we are unable to make any sense out of the various inputs that we receive at the state level. Whereas on the private sector, when you look at IT, they have gone miles and miles ahead. Now they have gone to the level of remote ICU, managing the ICU patient remotely from their command centers. So here we have various levels of activity happening, looking at the public and the private sector. So what the state is planning to do is, whatever is the good work that is happening in the private sector, try and see if we can work with them, use their technical expertise and take the mission forward of delivering the affordable healthcare to a citizen. So gone are the days when we are looking at doctors sitting in a PHC, because we don't get doctors nowadays to sit in a PHC. We have more than 30% vacancies of specialists in the government sector. Even the private sector, to a large extent, they are looking at remotely connecting various of their hospitals, their hospital networks, so that they get the right expertise at the command center. At the remote center, you can have any physician or a nurse to take care of the patient. So there are various levels of activity which are happening in the country. And we are looking at getting good models, including PPP models for using ICT in healthcare. So let us see what we have in store with various speakers on the dais.